All right, we're going to go ahead and get started. First off, welcome everyone to our first virtual Pickup Family Neurosciences Institute speaker series. My name is Taylor Tursa and I'll be your host this evening. I would like to extend a very warm welcome to our Pickup Family Neurosciences Institute committee members who are joining us this evening, as well as our benefactors, our 552 Club members, and some of you are actually attending your very first Pickup Family Neurosciences Institute event. So very, very happy to have you here. Thank you so much for coming. First off, I would like to, well, show my face. And I would also like to point out the Q&A section of this presentation. You can find it at the bottom of your screen. If you have a question at any point during the presentation, please feel free to click on this button and submit your questions directly to me. I will be able to view the questions as the presentation goes on, and I will address them to Dr. Oscar at the conclusion of this presentation. And rest assured, all questions submitted will be addressed anonymously, so you don't need to worry about your name being attached to any question you might have. I now have the distinct privilege of introducing a man who, quite frankly, needs no introduction. Dr. Michael Branswatsky wears a ton of hats here at Hoag. He is our senior physician executive here at Hoag, as well as our executive leader for the Hoag Center for Research and Education. And he holds the Ron and Sandy Simon Endowed Chair as the executive medical director for the Pickup Family Neurosciences Institute. He is our fearless leader for everything neuroscience, and I just feel honored to have the privilege of being able to introduce him. So please welcome Dr. Michael Branswatsky.
Still new to this unmuting thing. It's so hard on me. I think many people would prefer me being muted all the time, but I resist that notion. Thank you all for attending today, and it's my privilege to be with you, although it's not my privilege to be with you virtually. Taylor said, welcome to the very first virtual speaker series for the Pickup Family Neurosciences Institute. I'm hopeful it's the last virtual meeting like this, although I recognize that it might be very useful to allow virtual attendance when some of you can't make the in-person meetings going forward into the future. But with this virus seemingly waning, both hospitalizations in the Orange County area and in LA are clearly going down from the 700s in mid-July for Orange County total to the 400s, 440 being hospitalized today throughout the 30 hospitals of Orange County. And we're seeing that at Hoag as well. The number of new hospitalizations or hospitalizations in total are down to the low 20s at Hoag Newport Beach. And we were at our height in the 60s just a month ago. So a significant drop in hospitalizations, which tells us that there's a significant drop in the infections, the new infections that would be causing hospitalizations. You may have seen data that suggests there's a snafu counting new cases. They're not really new cases, it's counting new positive tests. Positive tests aren't necessarily new cases because one can test positive for up to several months from the original infection and only be infectious for the first 8 or 10 days or so. So positive new tests, we don't know how many there are, but we clearly know that there are fewer and fewer hospitalizations, which indicate fewer infections. And so I predict by mid-September, we'll be back to the March baseline. There'll still be an occasional infection and occasional hospitalization, but I really firmly believe that we've seen the worst. That's the good news, but that's not the purpose of discussing things with you today. I just wanted to share that news for those of you that are interested. We're here to talk about the Neurosciences Institute, and particularly one of the programs or businesses of the Institute. Each business is focused on a patient condition. Today we're talking about back pain and spine conditions in patients, and how we have a multidisciplinary team producing the best outcomes possible through a combination of dedicated talent, like my colleague, Dr. Burak Özgür, who leads the Neurospine program at the Pickup Family Neurosciences Institute. The talents, the technology, and the facilities are all at world-class levels here at Hoag. I could have the next slide, please. I just want to note that the US News and World Report, for those of you that haven't seen the latest rankings that came out about a week ago, again ranked neurosciences, neurosurgery, and neurology at Hoag in the top 1% in the nation. Dr. Özgür will embellish on this accolade a little bit further, but suffice it to say, without your support, the support of our community, partnering with us in attracting the best talent, procuring the best technology, and creating the best facilities, we couldn't be in the rarefied air of the top 27 or 30 institutions in the country. We are the top institution in the US News and World Report that doesn't have a formal academic neurology or neurosurgery training program. Everyone ranked above us has that, and there are many, many behind us who also have that, but there's no one ahead of us who, like us, does not have a training program. And I might note that behind us are such notable names as Yale and Duke. So we're doing pretty well thanks to the talent, the teamwork, and of course the community, without whom we could never achieve these accolades. So with that introduction in mind, I'm going to turn it over to Dr. Özgür. Burak is our chief of the Pickup Family Neurosciences Institute Neurospine program, and I helped convince Burak to come here from Cedars, and he'll tell you a little bit more about himself as he introduces the program. Really glad he was able to take the leap of faith, as I call it. Whenever I recruit, I always talk to folks about taking the leap of faith and having the landing platform for that leap be something that looks like this, what you're looking on the screen. That makes the leap of faith much easier. But back in the day when Burak took the leap, we weren't ranked at all in the US News and World Report. The Institute was just beginning, and certainly Dr. Özgür helped us to get here. And so for that, I'm extremely grateful to him, as well as for his leadership, and most importantly, his friendship. So Burak, it's all yours. Actually, cue the commercial.
Most back pain is due to muscle strain, and not everyone needs surgery. Hoag's Neurospine program offers innovative methods to reduce pain, inflammation, and improve mobility safely and effectively. Should you need surgery, Hoag is the leader with minimally invasive techniques, 3D imaging, and robotics to restore your golf swing or your swing dance. Many of our patients go home in just a few hours, walking the very next day. Call our dedicated nurse navigator for an evaluation. We've got your back.
We've got your back, particularly Dr. Özgür has it.
Thank you very much. Thank you, Dr. BZ, for a great introduction. Thank you, most of all, for really bringing this program together. 10 years ago, when I first started in 2010, as Dr. BZ said, we just had a group of doctors here in a community hospital, but we've come a long way, and I'll talk about that more a little bit later. I want to thank all of you for being here with us tonight for a brief, sort of a State of the Union address on the spine program here at Hoag. We've certainly come a long way, and I'm going to describe kind of where we've been and where we are at now and where we're going. So it's a very exciting time for us for what we've been able to accomplish. I want to thank the foundation for inviting me tonight here to speak with you and give this summary. And I want to thank all of you for your time, your dedication to watch this, but also for the support over the years. We couldn't have been here without you, and we appreciate your continued support. With that, the next slide, I'm going to show you actually a video of a patient. She's basically the star of the show. This is why we do this. And you'll see in her face and in her mannerisms and the agony before surgery and the success after surgery. This is why we do it. This is why we're here. And if we can scale that and help more and more patients, then it's been a success. And this is all for the good. So with that, here is Joan.
My name is Joan Lindsey. I'm 82. I had to give up swimming, sewing, playing cards with my friends, going out to lunch, playing the piano. I can't sit for any length of time. The pain is really extreme. I have a cyst on my spine that's aggravating the sciatic nerves. So I went from doctor to doctor to doctor, and they said I couldn't have surgery because I was too old. Dr. Oscar was the last one on my list to see.
It was a joy to see Joan. When I saw her, I really felt that she was an ideal candidate.
I mean, as soon as he walked in the room, it was like the light went on.
So you may say, well, how is an 82-year-old patient an ideal candidate for spine surgery? Well, spine surgery has changed a lot. There are minimally invasive techniques we can offer patients of all ages, including patients who are 80s and 90s. And she was suffering for quite a bit. She tried conservative options, physical therapy, injections, and nothing worked. So when we offered her the surgery, she was quite happy that she had an option other than suffering and pain and narcotics. Surgery went nice and smooth, took under 2 hours, and within a couple hours she was up and walking, and happy and smiling, and beating down the door to get out of the hospital. And she was excited to go on with her life. So it was really a blessing to be able to help Joan and get her back on her feet and back to her life as quickly as possible.
I asked him if he'd like to come home with me.
Her age really didn't matter because she was healthy.
Walking for the first time after surgery was amazing because I didn't think I could do it. And then there was no pain at all, and it was just great. I have so much energy now, I'm almost in trouble because I'm trying to do too much. The staff at Hoag was wonderful. I've never been treated so well. Thank you.
You're welcome.
So it's wonderful to be able to share that video because it really just shows in her face what we're able to accomplish. And when I say we, it's a big team. It's certainly not just me. It's a whole host of other people, including the nurses, the OR technicians, the assistants, the radiologists, pain doctors, neurologists, the nurses, the technicians. I mean, the list goes on. And they make me look good because I'm able to help Joan, but it's really a team. We can't do it without every one of those members. So why is spine important? Well, as you see there, number one, back pain is number one reason for doctor visits for physical pain. Back pain is most common non-cancer related condition to require opioids. And we know about the opioid epidemic in the United States. 100 million Americans, a third of Americans, suffer from neck or back pain each year. Back pain is the number one cause of job-related disability in the US. 80% of working adults will experience low back pain sometime in their life. So these are tremendous stats. I mean, this shows how common back pain is, or neck pain, and why spine requires a programmatic approach towards treating the community. And that's what we do here at Hoag. But what does it take to have that service? Number one, we need the right people here. We need the physicians, the nurses, the support staff to really bring this all together. Number two is we need diagnosis. So patient will come with their back or neck pain or their complaints, but it takes a lot to try to figure out what exactly they have. Because when somebody says neck pain, it could really be something else altogether. It could be that they have degenerative disc, spinal stenosis, a host of other things, or non-spine related. So the most important part is actually the diagnostic piece, and that may include taking x-rays, MRIs, and so on. But after we make the diagnosis, then the treatment is really the key. But having a whole host of treatment options. Surgery is just one piece of that. Physical therapy, pain management, acupuncture, physiatry, neurology, all of these can play an important role in the treatment as well. Again, surgery is just one piece of that. Minimally invasive surgery being one piece, traditional surgery being another. So it really takes a lot to, number one, make the right diagnosis, but then be able to treat the patient appropriately. Now, if we look at surgeries and where the program has gone, the numbers and the program I'm describing to you is all just at Hoag Newport Beach. HOI, the orthopedic surgeons, is a whole different program. And what we have here is demonstrating just the work of the neurosurgeons here at Hoag. So the neurosurgical spine program in Newport Beach, back in 2010, we only performed 316 cases in the year. And that was the first year that I got here. After that, we've grown steadily, and now we're over double that. So in 2019, we performed 747 surgeries. So what is minimally invasive? Because you'll see that focused a lot in my presentations, but also in the stat here. That back in 2010, we had only performed 7 minimally invasive spine surgeries. But in 2019, we've gone up to 267 surgeries of minimally invasive techniques. That's a 44% increase since 2015. So what is minimally invasive? That's a whole other lecture we can give sometime. But basically, the benefits of minimally invasive surgery are basically that I'm trying to do a surgery through a small cut. I'm working through the microscope. We're trying to solve a problem through a small cut, like as if an endoscopic general surgeon may take out an appendix or a hysterectomy for an OB-GYN. But it's basically, we're trying to solve the spine problem through a tiny incision. And if we can, then the result, the benefit to the patient is tremendous. Patients will leave the hospital sooner, they'll have less blood loss, less infection rates, and the stats are tremendous. The last time I had a spinal infection in a patient is years ago. We're talking thousands of patients, and readmissions, complications, length of stay, they're all better with minimally invasive. That's why it's important that you see such a big jump and continued growth in minimally invasive options. Now, the average length of stay is a significant statistic as well. So how long does a patient stay in the hospital after a surgery? In the national average, there's a big spectrum here, depending on types of surgeries, but the average is about 5 days. In minimally invasive spine surgery, it's 1.7 days. So already that's huge, between 1.7 to 5. That's less than half. And when you look at, well, what does it mean if a patient stays in the hospital longer? Well, it may mean they're exposed to other patients, potential infections, blood clots in the legs, urinary tract infections, pneumonia, so on and so forth. So these things can occur. So it's always better to get out of the hospital, even in a beautiful hospital like Hoag with an ocean view. It's still better to get the patients out of the hospital, get them home, get them functional and moving as soon as possible, safely. Now, when we talk about admissions, that means a patient was technically admitted. A outpatient surgery, a patient was never admitted technically. So what this does not include are the patients, significant number of patients that are done as an outpatient, whether at Hoag or at the Hoag Surgery Center. So those patients, which are not included in these numbers of length of stay, would bring down the length even shorter. But technically those patients were never admitted. They went home on the same day. So that also demonstrates that we provide surgeries for patients where it's done minimally invasively in an outpatient setting where they went home quickly. Now, what else have we created here at Hoag? We've created the neurosurgery spine program, Spine Triage. So what does that mean? Basically, all that means is we created a central phone number. So any of the ads for the spine program or informational programs or the website go to a central person. It actually goes to a nurse navigator that we've worked with for years. She's a wonderful lady that has learned about spine health and diagnoses and treatment. She spends her days in the hospital and she visits patients throughout the day. And then she also answers these phone calls and emails about spine program. So these patients may complain about the neck or back pain, but where do you go from there? So I've worked with Julie over the years, and we've created an algorithm. So this is the triage. So a patient may call and say, oh, my neck hurts, my back hurts, my arm goes numb, my leg goes tingling, this and that. So then she'll ask a series of questions. Well, Mrs. X, what happens when you do this, and where does it hurt, and what have you tried, and what other medical problems do you have? What she's trying to determine is, well, what is the urgency level? Does this patient need to go straight to the emergency room? Did she say the key words that we've worked with? Did they not? Maybe they don't even have a primary care doctor. Maybe they have untreated hypertension or diabetes. Well, those become now the priority. So if they don't have a primary care physician, then we send the patient among the Hoag family of primary care doctors to actually establish care with a primary physician, which is very, very important. Maybe they have a primary care doctor, but they have a chronic pain issue. Maybe they're on opioids. So then we need to get them to a pain specialist to try to wean them down safely before any talk of surgery. Maybe they need additional tests, they need imaging, they need physical therapy. So maybe we want to jump to physical therapy, a weight loss program, acupuncture, so on and so forth. So this is all part of that triage system. At the end of it, one of the little roots on the tree is surgery. So some of these patients will end up seeing a surgeon, myself or one of the other excellent surgeons in the program, and they may eventually need surgery. But this triage system is really meant to try to figure out who needs what and get them through efficiently. Imagine the concierge at a fancy hotel. So we're trying to have a concierge-like service to the spine program so patients are efficiently managed through the help of the nurse navigator. So when we first launched that in 2014, in that first year, there were 268 phone calls or emails to the program. And in 2019, that doubled to 569. So that's working. So this program has successfully helped serve the community, and that number continues to grow, and we could scale this triage system to serve more and more of the community. So that's the triage system that I wanted to mention. So what kind of tools help us if the patient eventually needs surgery? Well, through the help of philanthropy and the Hoag Foundation and such amazing generous donors like yourselves, we've been able to buy some equipment. We outfitted and built 2 beautiful, huge ORs with state-of-the-art equipment. What you're seeing here is a video of what's called 7D spine navigation. And what we're doing here is we're able to register the patient's CT scan into a computer, and through the computer, I can connect instruments that I use in the operating room. And while I'm operating, I can see in space where those tools are, how deep I may need to go and cut. And basically it'll project my instruments before I even touch the patient, so I can project exactly where I'm gonna go. This particular equipment actually uses machine learning, the same type of navigation in a Tesla vehicle. So it's very state-of-the-art, and it's exciting to be able to use this when necessary. So this has been a great tool that's available to us in the operating room. Another great tool is a robot, and we actually have this robot in the operating room as well. We actually have both the 7D navigation and we have the Globus Robot. Why is that important and why is that unique? Well, in the United States, there is no other hospital that has both this robot and this 7D navigation. Again, we can only do this through the generous support of the foundation, donors, and philanthropy in general. So it's amazing that we can be given these tools to help us be better. So what does this robot do? The robot does not operate by itself, so don't worry. You know, I'm not out having some coffee and I'm setting a robot to do your surgery. I'm in there, I'm scrubbed, I'm controlling this robot. But what the robot is doing is it's helping assist me in guiding my instrumentation. So I can take the same CT scan of your spine, I can draw like on an iPad-like device where I want to put the screws or plates in the spine, and then I can project this robotic arm to go to the exact trajectory. So what you're seeing in the video here is we're taking some localizing images. And when I fast forward, you'll see now I'm deploying the robot to go exactly where I programmed it. And then it's going to hold the trajectory for where I want to literally shoot a screw in. But I'm controlling everything. So again, There's not going to be any rogue robots running around in people's spines. This is all surgeon controlled. So it's really assisting the surgeon. It's not replacing the surgeon. But in any case, this is a great tool that we use in certain surgeries. We don't need it in every type of surgery, but this is, again, a great tool made available to us through the amazing support of the Hoag system. So moving forward, what else have we accomplished? So as I said, I started here in 2010 with just a few surgeons. We didn't really have a formal spine program, but through time, we've been able to also publish. We have actual research going on, even though, as BZ said, we're not a formal academic institution with residents and fellows. But in time, we've been able to publish articles. These are some of our articles that we've published. This is actually a book that I wrote on minimally invasive spine surgery. It's a textbook for other surgeons to learn some of these techniques, but we've published. We have IRB approval for data collection and to publish our outcomes, whether cranial cases for the cranial neurosurgeons or spine for the spinal neurosurgeons. So we've also been publishing a lot, and that's why we're getting some recognition. We present in national and international meetings the work we do here at Hoag to help patients and further the cause. So it's exciting that we're able to do academic work in a technically non-academic facility. So what goes next is our own philanthropic help of the community. So here I was blessed to be able to take a group to the Middle East and be able to help refugees in poor areas who are oftentimes caught in war-torn areas, and patients are suffering. Just like we may be suffering with spinal problems in our homes here in the States, imagine being in a part of the world where you really are worried about electricity and running water. These patients are suffering from that, and they're devoid of proper clinical care. So through philanthropic support and different foundations, we were able to travel 3 times now with a team to be able to help hundreds of patients and dozens of surgeries. As you can see, the equipment are not the best, but we did what we had to, and we were really able to help dozens of patients and have just amazing outpouring of support and love and appreciation. We were even able to bring a patient to the United States here at Hoag to help her. I met a 18-year-old girl a few years back. Her condition was so severe, we couldn't safely do it back in her home. So we actually had the support of the charity organization, but also of the Hoag Foundation and the Hoag Hospital and facilities to allow me to do the surgery for free, as everything we've done for the mission was free. But we brought the patient here, and Hoag allowed me and the anesthesiologist and so on to provide the surgery for her for free. She came out here with her mom, and we performed the surgery. She did amazing. She was walking in 1 day. She left the hospital in 2 days. And within a week, she was actually, a week after a major spine surgery, she was actually walking the beaches with her mom. And I think they actually went to Disneyland as well. So it was an amazing thing to be able to provide. Now, this is a great thing that we want to continue doing throughout the world, but we also have people in need here in our own community. Here in Orange County, there are a lot of people that don't have resources to care for themselves or don't have access. So we're also currently working with Hoag and various donors and organizations to try to figure out a system for us to be able to provide spinal care for some of those patients as well here at home. So that's a wonderful thing that I'm proud to be a part of. Now, my journey has taken me through many different areas. I trained, of course, in an academic institution at UC San Diego, and been there through a 7-year residency program in a combined orthopedic neurosurgery spine fellowship, which at the time was one of the only ones in the country. In any case, I got a broad experience. Then I went to academia. I was actually at UCI right out of residency. I thought I wanted to go into a formal academic program. Then I was quickly recruited to Cedars-Sinai, went there, had a wonderful experience. I was chief of minimally invasive spine surgery in the neurosurgery department at Cedars-Sinai. Wonderful hospital program and facility, and I learned a lot. and grew a lot at that program. But what did I find? I found that 42% of my business at Cedars-Sinai in LA was coming from Orange County. It was Orange County patients that were seeking minimally invasive surgery options, didn't find it in Orange County, and they were coming up to Cedars-Sinai to see me up there. That told me that there was a void. There was something missing here in Orange County. Secondly, is there are pros and cons at every institution. And so there were definitely things that were very strong and wonderful at Cedars, but also some things that were frustrating. Just like any hospital, including Hoag, we have our strengths and weaknesses as well. But as I got to know BZ and the opportunity and things that we could create here at Hoag, I jumped ship and left Cedars and came over here. And what did I learn here at Hoag? Well, I've been here for 10 years, so obviously I'm happy and things are going well, and I'm boasting about what we've created together here at Hoag. But what I found is what was missing at Cedars that I found at Hoag was I found a family. I found that I was not a surgeon working in a silo, just worrying about my own business. I'm actually part of a family where people care. The administrators, the executives at Hoag care, BZ cares, Taylor cares, and we're trying to help the community. It's something really special. It doesn't exist everywhere. I do feel that people are trying to create a better service for the community and build an institution around caring people who love to work together, but ultimately to treat the patient. I did not feel as much support in that realm at Cedars-Sinai. Again, Cedars is a great institution, but I do feel Hoag is greater in many ways. And one of the key elements there, again, that I felt here at Hoag that we have strong is that the foundation is so tremendous. The philanthropic support, the donor support, it's really palpable. It's really amazing. If there's something that I need or want, like the robot or the navigation or whatever it is, brand new ORs, I can make a few phone calls, talk to a few people, make a case for why we need this or that. And if it's valid, then within a short period of time, the foundation talks to a few donors and we put our heads together and we find a way to make it happen. That's amazing. I didn't feel that in the academic institutions. I didn't feel that at Cedars. So it's really tremendous. And that's what helps keep me here, because they help give me the tools to do a better job for our patients and serve the community. That is tremendous. And that's why I'm still here, because I feel part of that family and I feel supported, and I appreciate that. So moving forward, then what's the next step? Because we've come a long way in 10 years. As BZ said, 3 years ago, we didn't even make the ranking on the US News and World Report. We were nobody. We were a good community hospital. We did great things for the community. We serviced all the different service lines, patient ailments. But as far as the rankings in academic institutions and big programs around the country, we didn't even make the list. So we've been working hard as a team and improving patient care and outcomes and diminishing complications and lengths of stays and learning from one another and building this support network. And we've slowly climbed the ranks. So 2 years ago, we were not even ranked. And then last year, we actually made the ranking and we actually hit 37, which is pretty good. But we always had our sights high. We aimed really high. We looked at big programs, Duke, Yale, UCSF, Stanford, Cleveland Clinic, Mayo Clinic, Rothman Institute, orthopedic programs, neurosurgical programs. How can we get better? We've worked hard. And I'm proud to say that we really have come a long way. Now, this last ranking, which ironically just came out a week ago, was amazing. We continue to grow. We've been, as a Hoag hospital institution, we've been #1 in Orange County for years. So that's not new. That's something we're proud of and we've been able to maintain. Now, if you look at Los Angeles and Orange County together, we're #4. That's amazing. There are a lot of great hospitals in those regions. But who's above us? UCLA, USC, and Cedars-Sinai, and we're #4. Those are all academic institutions that have strong history. We're relatively new in this arena of being recognized in the US News and World Report. So being number 4 is great. Well, how about in California? We have a lot of great programs south and north of us, particularly in in the Bay Area. UCSF, Stanford, for example, wonderful programs. Well, when you include everybody, we're number 8. Again, a great honor to be within California, ranked number 8 as a hospital as a whole. Well, what's the ranking of particularly neurosciences? So neurology and neurosurgery are looked at together in US News and World Report. We ranked now 27. Remember, 2 years ago, we were not ranked. Last year, we were 37. This year, we're 27. And keep in mind, look at the screen, we're above Duke, we're above Yale. Those are amazing programs with amazing pedigree, and we are ranked higher than them in neurology and neurosurgery. Barrow Neurologic Institute is an amazing program in Phoenix. They're just the one right ahead of us. It's amazing that we've come this far in a short amount of time with what we've been able to create so far in a non-academic program. We don't have residents, we don't have fellows. And so, of course, we have to look at programs even higher than that. So NYU, UCSF, UCLA, great programs, and we got to keep striving to be better and better. And looking next at what is coming in the future, because I'll never stop striving for better. So I'm going to keep pushing Hoag. Hoag will keep pushing me, and we need support, continued support from everybody, and this team will continue to grow. So let's scale even bigger. So what do we have in mind? Our plan is the Hoag Spine Institute. So what does that mean? Basically taking everything we've done so far and amplifying it even better, scaling it. So a strong business plan and growing it even bigger, to make a business analogy. So we want to scale. So what does that mean? A multidisciplinary, patient-focused, objective, measured program where we can create a world around spine to better service the community. Multidisciplinary meaning bringing together surgeons and non-surgeons alike, physical therapists, pain management, neurology, PM&R, I can go on and on. But bring everybody together around the same table. Not the surgeons sitting on a higher chair. No, we're all equal, we're all learning from one another. As I mentioned, surgery is just a small part of the spine program, but we need to put our heads together on how we can learn from the neurologists and the physical therapists and the acupuncturists and the nurses and the technicians, because we can learn from one another. We want to maintain the equipment, the state of the art. We want to maintain focus on education and research. We want to publish, we want to learn. We want to have case conferences and journal club and learn. Basically, I'm describing a lot of things that the academic programs have. So we want to continue on that road for better patient outcomes and better service to the community. So this will start as more of a virtual program early next year. It'll evolve, hopefully, with your continued support, is over the next 5 years, we want to be in a physical space together. We want to have a one-stop shop where we have everything together. We don't want to have to send patients across town to different places. We want to raise that concierge level treatment a step higher so that we can service patients better. As those of you who know who've had back or neck pain, when you're suffering, every minute counts. So we don't want to waste time. We want to be efficient. We want to be accurate. And we want to push ourselves to be better each year. With your continued support, hopefully we'll be able to achieve that. We'll be able to create an endowed chair for the program. We'll be able to additionally educate nurses, recruit other talent, and bring our program to higher and higher levels, ranked and recognized in the community and in the world, quite frankly, to show that we can do this and we can have the patient focused, community focused, and be successful. So that's the dream. I appreciate your continued support. I appreciate your time this evening and the foundation, and for those putting this opportunity together for me. I'm humbled to be a part of this team that makes us successful in our overall mission in serving the community. Thank you very much, and I welcome any questions.
All right, thank you so much, Dr. Oscar. I do have a couple questions here from our audience members. I'm going to change the view here really quick so that they can see both of us on the screen at once. There we go. All right. So a couple questions here from the chat. Thank you all for submitting them. We have a few here regarding minimally invasive spine surgery. So I'll start there. The first question is, does having minimally invasive spine surgery offer fewer complications?
Yes. So the answer is yes. The minimally invasive surgical techniques do generally result in fewer complications. The caveat is the person doing the surgery, just like with any surgery, needs to be experienced in what they're doing. So there are limitations. We can't do everything minimally invasively. We can do probably 90% of surgeries minimally invasively, but not everything. So there are limits. If we identify our limits and we do what's safe and effective, then yes, it does result in fewer complications.
Okay, awesome. This next question, I believe you touched on a little bit, but maybe you can expound on it a little bit. What does the recovery time look like for patients that receive minimally invasive spine surgery?
So the recovery time varies, again, by the type of surgery. If you're doing a spinal fusion, if you're doing a cervical versus a lumbar, the recovery time will be different. If you're doing a microdiscectomy, that's a smaller operation. So it varies. But in general, most of our patients who've had minimally invasive surgery are only in the hospital for 1 or 2 days. In fact, many of them go home the same day. The recovery time, however, though, they're still feeling pain. As some of you may have had surgery, even though you leave the hospital, doesn't mean all the pain's gone. So you may end up with a period of time where you're still recovering, you're walking, you're moving, you're going up and down stairs, but you may have some pain. But generally it gets better day by day. Most patients are driving within a week or two, and most are starting physical therapy and exercising, starting to swim by a month. So I generally say a rule of thumb is most patients, most surgeries are basically looking at a recovery period from surgery about a month, and then gradually returning to normal function gradually after that.
Great. And then the last one here that I have on minimally invasive surgery is how big is the incision that you utilize for minimally invasive care? And how does that compare to, I assume they're asking about like a traditional back surgery?
Yeah. So the incision size varies as well, depending on what we're doing. So sometimes I'll make an incision that's smaller than the width of my thumb. So I just need a little bit of space to get a little retractor and look through the microscope. But some surgeries are bigger. So a couple inches could be on a multi-level decompression. And traditional surgery may be several inches long. But again, it varies per patient because everybody has a different situation. Sometimes we do make the incision a little bit bigger for safety and to be able to see safely, effectively. But it can vary from that much to that much in most minimally invasive surgeries.
Great. And then I guess a question from me to kind of piggyback off of that is how does minimally invasive surgery kind of help folks recover in their recovery in comparison to kind of those larger incisions?
Well, the recovery is big. So what you see, or excuse me, the difference is big. And a way to think about this is the incision is the only thing that you see as a patient. So you'll see the size of the scar, you'll look in the mirror and kind of see what your cut looks like. What it doesn't demonstrate is what's gone on inside. So think of like a glacier. You're only seeing what's on the surface, but you're not necessarily seeing what's underneath. If there's a small incision, then most likely the intervention below, meaning the retraction and any damage to soft tissue, like muscles and ligaments and so on, is probably minimal as well. However, with a bigger incision, you've probably cut more tissue or retracted more tissue. So why does that matter? A larger incision usually will result in more pain, more blood loss, more risk of bleeding and infection. So smaller diminishes all those things. So the other element of this that's important is in the recovery period. So if you've cut more, then there's more to heal. So a patient who's had a small incision may have a shorter recovery period. And the physical therapist even mentioned, and they know that when there's a small cut, there's been less soft tissue damage to the surrounding muscles and ligaments, which are all important in your recovery. Whereas somebody who's had a larger cut, there's more collateral damage. And what I mean by that is the muscles, the tendons, the ligaments have been potentially damaged more, and there's more for them to recover. So patients may suffer longer in their recovery period, but they're also more vulnerable then to have problems down the line. So that's why it's important to make a diagnosis. Instead of treating 5 levels, maybe you only need to treat 1 or 2 levels. And whatever it is, try to focus on exactly what the diagnosis is, and then figure out what is the least invasive way to treat that program or that problem, excuse me. And then achieve that as effectively, efficiently as possible, safely as possible. And then that usually results in, again, better recovery periods as well.